Aside from teenagers dislocating their shoulder during a contact sport, the most common cause of a person presenting with shoulder pain is usually under the umbrella of impingement syndrome. Impingement syndrome basically means pain that's coming from the bone of the acromion, which is this right here on the top of your shoulder, pinching the underlying rotator cuff and/or the biceps tendon, which is sort of underneath the rotator cuff once it enters into the shoulder. And this is really important because the biceps tendon comes up through a bony groove. It's covered by a ligament not shown in this model, and then attaches into what's called the glenoid, or the socket of the shoulder. And that can be irritating in itself, or it can be getting pinched by the bone. And in people that are having this impingement process, it can actually erode through the tendon and cause a tear of the rotator cuff. We call them rotator cuff tears. Or they can also tear spontaneously. Historically, that was something that happened in older people in their late 60s and 70s. The more active we see people engaging in all sorts of activities, we're seeing torn rotator cuffs at a younger age, as young as the mid-30s these days, which is kind of unusual, but we're seeing it, so we have to be aware of it. When people come and complain of pain, we have to pay attention to it, because an untreated rotator cuff can not only make it hard for a person to get along, but if it's a large tear, it can become the point where it cannot be repaired. And that's a devastating situation for some people where they can't move their arm through a full arc of motion, and the motion hurts them. And so we want to treat that aggressively. A person would come in complaining of shoulder pain, we examine them, see if there's tenderness, what the range of motion is. Is there any weakness to indicate that the rotator cuff has a tear, etc.? And not only get plain x-rays to look at the contour of the bone, but if the person's not responding to non-operative means with injections or oral NSAIDs, such as ibuprofen, or better ones such as meloxicam, which is the only truly once-a-day anti-inflammatory, then we take them into surgery if x-ray suggests that they have prominent bone, or if an MRI becomes necessary and proves they have a torn tendon, you need to repair those. Okay, so impingement syndrome. Person comes in, examine them for range of motion, localized tenderness. The person's hurting mostly at the top of the shoulder. Chances are they have AC joint arthritis. MRI studies have shown that by age 40, 70% of us have arthritis in the AC joint. Now, it doesn't usually show up in the plain x-ray until it's more advanced. And that's where an MRI can really help things out. So why would one do an MRI on a shoulder? I think it's grossly overused, but if you have somebody who has normal bone contour, continues to hurt despite medications given time, etc., maybe get an MRI and look and see if they have what's known as rotator cuff tendinosis. And that shows up in the MRI as increased water content on the rotator cuff. That person will not benefit from surgery. They just need to bear with it, and eventually the symptoms should go away over time. But if we find a torn tendon or a prominent bone, or if it depicts the arthritis of the AC joint, then any or all of those can be taken care of surgically.